In today's class, we will be discussing about high frequency nasal cannula and the normal nasal cannula. What are the advantages of a high frequency nasal cannula over a normal nasal cannula? The advantages is of a high frequency nasal cannula is that it is able to heat the gas to 37 degrees Celsius with a 100% relative humidity, and it can deliver FiO2 up to 21 to 100%, and it can deliver flow rates up to 60 liters per minute. And the FiO2 and the flow rate of a required for a patient can be titrated as per the patient's requirement. So these are the three devices which are available on market: Vapotherm, OptiFlow and AirVo2. So how it provides? What are the advantages of providing heat and humidification? While a normal nasal cannula, it actually delivers a cold and a dry gas, which can lead to airway inflammation. And this can increases the airway resistance, and which in turn will impair mucociliary clearance, and that will result in secretion pooling up, and the patient himself has to expend significant amount of energy to both warm and humidify gases. While a high frequency nasal cannula deliver heat and humidified gases, which will prevent the secretions getting drying up and will help in easy clearance of secretions. This is particularly useful in patients having a pneumonia with a significant secretions. So this helps in that scenarios. So second is inspiratory demand. So high frequency nasal cannula improves a patient's work of breathing by matching their peak inspiratory flow demand, while a nasal cannula cannot match flow demands if patient is tachypneic. So like if the patient is normally breathing like 12 breaths per minute at tidal volume of 500, the minute ventilation requirement is 500 into 12, that is almost up to 6 liters. While if a patient becomes tachypneic, the minute ventilation increases. So the respiratory rate may increase up to 30 breaths per minute or 35 breaths per minute. In that case, the inspiratory flow demand of the patient will also increase like 20 or 40, 20, 30 liters. So if a nasal cannula, if we are giving at 1 liter, the FiO2 will increase by 21 plus 1 into 4, that is 25%. If you are giving 2 liters by nasal cannula, there is a 1:4 rule. That is, for every 1 liter increase, 4 percentage of FiO2 will increase. So if we are delivering 2 liters, the FiO2 will increase to 29. So up to 4 liter we give in a nasal cannula. So if a patient becomes tachypneic, its inspiratory flow demand will increase. So he may require up to 20 liters of oxygen. In that case, only 4 liter we can provide through the nasal cannula. So the rest of the 16 liter, the patient will breathe from the or take in through the oral cavity as the patient becomes tachypneic. So that is actually a room air at 21% FiO2. So this 16 liter at 21% of FiO2 get mixed with the 4 liter of gas, which is almost at a 21 plus 4 into 4, that is 21 plus 16, that will be almost 37% FiO2. So the net effect is patient will receive only up to room air FiO2 only if a patient is breathing through a nasal cavity, a nasal cannula, because of this entrainment of the air. While a HFNC, it can meet the inspiratory demand. It can deliver if the required FiO2 up to 60 liters. So usually in adult patient, the flow respiratory demand will increase up to 30 to 40 liters per minute. So even up to 60 also, the HFNC can meet that demand at the required. If we are setting at 50% FiO2, it can without entrainment of room air, it can deliver the inspiratory gas at 50% FiO2. So that is the HFNC can meet the inspiratory demands. And also, for each 10 liter increase in flow in the HFNC, the PEEP will increase by 1 centimeter of water. So when we may keep the inspiratory flow at 40 liters, the PEEP there will be 4 centimeter of water PEEP. So that will help in alveolar recruitment and increase the functional residual capacity. Also, this PEEP will increase the intrathoracic pressure, or it will make the intrathoracic pressure less negative. That will result in decreased preload, the decreased venous return coming to heart. So particularly in a post cardiac surgery patient, when there is a heart dysfunction is there, we want the preload to the heart to come down. That depends. So in that case, if we give some PEEP through HFNC up to 4 centimeter by 40 liters, will provide 4 centimeter of water of PEEP. So that will reduce the preload at the heart, and the less negative intrathoracic pressure will also reduce the afterload of the left ventricle. And also this HFNC is by a tightly fitting nasal cannula which we put on the patient's face. So that will result in better patient compliance rather than the CPAP or the BiPAP mask which covers the nose and the mouth of the patient, and it is very suffocating for the patient. So this is better tolerated and better patient compliance compared to CPAP and the BiPAP masks. So this is the oxygen dilution which happens in a normal nasal cannula because of the entrainment of the room air, which will result in a low FiO2 or up to 21% FiO2 gas to be delivered, while a high frequency nasal cannula will result in FiO2 up if we are setting at 40% FiO2, the high flow demand can be met by increasing the flow rate, so the oxygen can be delivered without dilution. So that is an advantage of high frequency nasal cannula over the normal nasal cannula. So another advantage is that when we normally breathe, so one third of the tidal volume will be from the dead space air. That is, the dead space will be having the previous expired gas. So that will be having only up to 15 to 16% oxygen and more of carbon dioxide. So this dead space will actually increase if the patient has some underlying pneumonia or any lung diseases. So if a patient is rebreathing through a normal nasal cannula, the dead space will increase and result in a more rebreathing of carbon dioxide. But if we give a high frequency nasal cannula, it gives you a continuous flow of fresh gas at high flow rates. So that will replace or wash out the patient's pharyngeal dead space. That is the old gas which is low in oxygen and high in carbon dioxide. And that in turn will replace that dead space with oxygen rich gas, and thus improves the breathing efficacy of the patient. So high frequency nasal cannula will help in wash out of the dead space more. That will help in more carbon dioxide wash out and will increase more oxygen delivery. So this is the code for remembering the advantages of a high frequency nasal cannula. High flow, that is heated and humidified gas, it meets the inspirated demand, it will increase the functional residual capacity, it is more lighter, and it will prevent oxygen dilution, and it will result in washout of dead space. That is, high flow is the code. So what are the adult indications for high frequency nasal cannula is like acute hypoxic respiratory failure, mainly in a community acquired pneumonia where there are a lot of secretion. This heat and humidified gases will result in secretions being thin, easy clearance, mucociliary clearance will be improved, and it will result in post extubation patients we can give a high frequency nasal cannula, which will reduce the re-intubation rates, and also pre-oxygenation prior to intubation. And also the patient is having do not intubate respiratory distress, we can give a high frequency nasal cannula, and also in cardiogenic pulmonary edema. And pediatric indications are like bronchiolitis, and also post extubation we can provide a high frequency nasal cannula. So these are the advantages of a high frequency nasal cannula over a normal nasal cannula. Thank you.